8 major mental disorders explained. We start with depression. Over 280 million people worldwide live with major depression according to the World Health Organization. It is not simple sadness, it shuts down the brain's pleasure centers. Dopamine and serotonin brain chemicals drop drastically, making favorite foods taste bland and sleep feel exhausting. Low chemical levels turn daily tasks into huge hurdles. A person with severe depression can lie in bed for 14 straight hours without the physical energy to brush teeth or eat breakfast. Brain scans show the hippocampus memory center shrinks up to 20% in people suffering long-term untreated depression. Memory and decision-making slow down sharply. Daily walking for 30 minutes increases brain growth chemicals, lifting mood in 60% of mild depression cases. Professional therapy and medication restore brain health. Next up, anxiety. Anxiety disorders affect 301 million people globally, turning normal everyday situations into terrifying life or death threats. The amygdala, the brain's emergency bell, fires constantly, spiking heart rates up to 130 beats per minute while sitting completely still. A simple phone notification causes chest tightness, sweating palms and stomach cramps within 3 seconds. The body preps to fight a threat that does not exist. People experiencing panic attacks visit hospital emergency rooms 5 times more often, believing they are having a fatal heart attack. Slow deep breathing activates the vagus nerve, calming the heart rate back to normal within 120 seconds. Now, bipolar disorder. Bipolar disorder causes drastic brain mood shifts between hyper-excited mania and paralyzing depression, affecting 40 million people. During manic phases, a person can stay awake for 4 days straight, spend life savings impulsively, and talk at double normal speed. Brain imaging shows emotional processing centers run at 300% hyper speed during manic episodes before running out of energy. After mania ends, the person crashes into severe depression, unable to leave bed or speak to friends for several weeks. Mood-stabilizing medical care helps 70% of bipolar patients level out brain chemistry and maintain stable daily lives. Let's proceed to schizophrenia. Schizophrenia impacts 24 million people, mixing up real sights and sounds with trick visions and voice hallucinations. Excess dopamine along specific brain pathways makes a person hear clear voices coming from silent walls or turned off radios. A person might believe secret agents are tracking them through television screens, throwing away fresh food out of fear. Brain scans prove auditory centers light up during hallucinations, exactly as if real human voices entered physical ears. Modern prescription treatments balance brain dopamine, reducing scary hallucinations for 65% of schizophrenia patients. And then OCD. Obsessive-compulsive disorder traps 1 in 40 people in constant fear, thoughts and uncontrollable repetitive physical habits. Terrifying intrusive thoughts like deadly germs or home fires force a person to wash hands 50 times every morning. The brain's error detector lock gets stuck on high, forcing the person to recheck door locks 20 times before leaving home. Skin raw and bleeding from harsh soaps is a common physical consequence of untreated germ ritual compulsions. Behavioral retraining therapy teaches the brain to ignore false alarm signals, helping 75% of OCD patients break habit loops. Transitioning to PTSD. Post-traumatic stress disorder alters brain wiring in 13 million adults after surviving car accidents, wars or violent attacks. Loud noises like a car backfire instantly trigger terrifying flashbacks, making a person dive onto pavement in sudden panic. The hippocampus loses its ability to stamp memories as, in the past, making 5-year-old trauma feel like active present danger. Nightmares wake trauma survivors 4 times every night, keeping bodily stress hormones twice as high as normal healthy adults. Specialized eye movement therapy helps the brain file bad memories into the past, safely curing PTSD symptoms in 60% of patients. Moving on to ADHD. ADHD impacts 366 million people whose brains lack steady dopamine signals required for sustained attention and impulse control. Sitting quietly to read 2 pages feels nearly impossible because the brain constantly hunts for fresh stimulation. A person misplaces keys, phone and wallet 3 times in one morning while starting 5 different unfinished projects at once. Prefrontal cortex activity runs 25% lower in ADHD brains, making time tracking and long-term planning difficult. Daily structure, task chunking and medical guidance improve task focus and reduce lost items by 80%. Next up, borderline personality. Borderline personality disorder causes rapid emotional swings where fear of abandonment turns affection into anger in minutes. A late text message reply triggers intense internal panic, making the person believe their friend has abandoned them forever. Brain emotional centers react 10 times stronger to perceived rejections than in typical healthy brains. People with BPD experience severe self-doubt, changing personal goals, jobs, and social circles multiple times per year. Specialized emotional skill therapy helps 80% of BPD patients regulate mood swings and build stable long-term relationships. Mental health disorders are physical brain conditions, not personal weakness. Professional medical support and understanding help millions rebuild healthy, fulfilling lives every day.